let's talk about the symptoms of a manic episode. So what are the symptoms which are included in the diagnostic criteria, that is in DSM-5? Let's talk about those symptoms. And we can remember these symptoms with a mnemonic. The mnemonic is me dig fast. So this is a mnemonic in which you can learn all the important symptoms of mania. So in the books it is dig fast. So we have added, modified it so that we can learn all the symptoms of manic episode. So as the name is suggesting, the person is doing something fast. So what is the mnemonic? So let's learn the symptoms. So M is mood. So how is the mood? So as in case of depression, we learned the mnemonic sides caps. The first symptom was mood. It was sadness. Here, the mood is elated. The person's mood is very expansive. The person is very cheerful, euphoric. And sometimes, as we learned, that it can also be irritable. There is low frustration tolerance is there, and subsequently the person may become angry on small issues, and sometimes even without any reason the person may become angry. So this is the first symptom. Second symptom again is E for energy. So the energy of these patients is very high, and also there may be increase in the goal directed activity. So there is a persistent increased energy or increased goal directed activity. So you may find patient may not sit at one place, may be doing so many things, and energy is very high. So if you ask, the person may say, I have so much energy that I can do anything. So the energy levels are high. So these are the first two symptoms. That is, mood is elated or irritable, and energy levels are high or goal directed activity is increased. Now let's come to the next symptom, that is D. D for distractibility. So these people are distracted very easily. So you're talking to them and suddenly there is some distraction from outside and they will focus their attention there. So they get easily distracted, and it may be reported by the family members, or you as a clinician may also observe it when you're interviewing the patient. So they are distractible. Then I is impulsivity. So as we have discussed, these people may have impulsive behavior, and there may be excessive involvement in activities which have high potential for painful consequences. For example, person is spending a lot on useless things, or maybe just throwing away the money, or they may be involved in sexual activities. There may be sexual indiscretions. So there is impulsivity. People are doing things when without thinking of the consequences. G is grandiosity or inflated self-esteem. So these people with mania may think very high of themselves. Their self-esteem is very very inflated, and they may talk as if they have they are at very high position, or sometimes they behave as if they are very important. So they have this feeling of grandiosity or inflated self-esteem. While if we compare it with depression, how would be usually the self-esteem of a person of depression? Again, very low. So again, some of the symptoms, as we can see, they are just the opposite. Then let's come to the next symptom. F is flight of ideas. So patient's thoughts are coming very fast, and as we discussed, the goal is not reached, and at times they may be connected, and sometimes patient may have this subjective experience. So the thoughts are racing so fast that patient may experience them, that the thoughts are racing. So sometimes patient may also experience this and may tell you this. So F is flight of ideas. A is activity. The activity, that is goal directed activities, increase. So person may do things, may plan new things and may start doing them. So significant number of things the person may do at one time, and sometimes there may be psychomotor agitation, wherein there is purposeless non-goal directed activities may also be increased. So the activity levels of the person is increased. S, again, as we had discussed, sleep. Very interesting. Sleep. There is a decreased need for sleep. So person may sleep maybe just for 3 hours and still feel energetic the next day. So there is a decreased need for sleep. And last is T. There is talkativeness. The person is talkative than usual, and we have discussed there may be also pressure of speech may be there at times. So these are the symptoms of mania. Me dig fast is the mnemonic you can remember. Now let's try to understand how to make a diagnosis of a manic episode. So in the diagnosis, in the criteria A, both first and second symptom, that is mood and energy or goal directed activity is increased, both should be present. and these are abnormal and they are persistently present during the episode. And we say the duration, minimum duration is 1 week. As we can recollect, in depressive episode we discussed the duration was 2 weeks. So here the duration is 1 week. But there is an important catch. The duration may be any, it may be even just days, few days, maybe 2-3 days, if hospitalization is necessary. So hospitalization is suggesting you that the person again requires supervision, maybe there is risk of harm to self or others. So then in that case, even if the duration is less than 1 week, we'll make a episode of mania. So this is the criteria number A. Then what is criteria number B? Now during this episode, during this period of 1 week, 3 or more of the following symptoms which we had discussed, or if the mood is irritable, then at least four symptoms should be there out of the remaining symptoms. So what are the remaining symptoms? As we had discussed, the remaining symptom with the mnemonic dig fast. So out of these, at least 3 should be present if the mood is elated. And if we see a patient with dysphoric mania, irritable mood, then we have to see at least 4 of these symptoms should be present. So in DSM-5, how we make a diagnosis? Both first and second symptoms should be there. Along with this, 3 or more symptoms, and 4 if mood is irritable for 1 week, then we say that is a manic episode. Now, what are the other criteria? Criteria number C is, since it's a disorder, so it should be severe to cause marked impairment in functioning. So the functioning, that is social functioning, occupational functioning, self-care, that should be impaired. And or there is, it necessitates hospitalization. So the symptoms are severe to prevent harm to self or to others, we have to hospitalize the patient. Or if psychotic features have developed, then so this is the next criteria. There should be at least, any of these 3 should be there. And it does not attribute to any physiological effect of any substance. So it should not be, induced by any drugs or medication, or due to any other medical condition. Then otherwise it would be induced episode. Now, a manic episode during antidepressant treatment, if it occurs, but it is persistent, it persists at fully syndromal level beyond the physiological effects of the treatment. When we see that all the symptoms are getting fulfilled and it seems that it is beyond the physiological effect of the drug, then also we can make a episode of mania. So again, this is an important catch. If it is induced, but if we see that the symptoms, all the symptoms at the syndromal level are present, it seems that, the physiological effect of drug is not explaining these symptoms, then we can consider it as a manic episode. So these are the criteria for making a diagnosis of a manic episode according to DSM-5. So let us take this case. So we have a 20-year-old male, and since 10 days the person comes to us with elated mood, very, very happy, full of energy, and patient, says like this: my name is John, I want an iPhone, going to Rome, stone, con, John, Ron. So if you can see in this, there is flight of ideas seen in the patient, a lot of clang association you can see. And there is a decreased need for sleep. He's sleeping for only 2-3 hours and still appearing very energetic the next day, and is also involved in a lot of impulsive behavior such as overspending. So this is how we make a diagnosis of mania. So this is a simple case scenario in which we make a diagnosis of mania. Now let's try to understand. So we have talked about the symptoms, the criteria of a manic episode. Now let's try to, as we did it in, even in schizophrenia, let's try to, for a understanding and learning purpose, let's try to, see what the symptoms, what are the symptoms and how they are reciprocating with the hypothetically malfunctioning brain circuits. So again, as, explained in, Stahl's, book, then, again, let's try to correlate that what are the symptoms and which area of the brain they are connecting to. So, different areas of the brain which we are focusing, as well as, you can remember it when we were discussing the etiology, we talked about certain areas which are implicated in the bipolar disorder. So now you can connect, what all areas, are subsequently leading to what all symptoms. So it includes, some of the areas such as striatum, nucleus accumbens, prefrontal cortex, again, very important. A lot of symptoms we'll talk about, even basal forebrain, amygdala, hippocampus, and other regions such as thalamus, hypothalamus, cerebellum, the neurotransmitter centers of the brainstem, again they are implicated. A lot of neurotransmitters such as serotonin, dopamine, again they have their neurotransmitter centers in the brainstem. Again, those are areas are also implicated, spinal cord, and so these are the important areas we'll talk about and we'll correlate it with the symptoms.